have had so many incredible stories over the decades of patients telling me once they started getting B12 injections, their depression completely went away. They didn't do anything else, just the B12 injections. People coming in that weren't even patients of mine that were getting B12 because it really moved their fibromyalgia, it removed their lack of energy. It removed their feelings of not being able to keep things organized in their brain. So the functions of B12 are DNA synthesis, red blood cell production, so excellent for if you're correcting any kind of anemia, myelin sheath repair, methylation. So homocysteine reduction, if you have an inflamed patient, their CRP or homocysteine levels are rising. B12 has been shown to lower that in an injectable form. Neurotransmitter production, if you're trying to move somebody in the area of mood, consider regular injections of at least B12. The B12 research is really good at demonstrating improvements in anemia, neurologic symptoms, peripheral neuropathy, fatigue-associated deficiencies, and elevated homocysteine. So we've got studies that show that it is very effective for diabetic neuropathy or any other kind of peripheral neuropathy, for nerve regeneration. So people post injuries with nerve regeneration, regular B12 injections can make a big difference there. And post-herpetic neuralgia. Now I'm talking about 1 to 2 B12 injections every week. And I'll give you a protocol for patients that have autoimmune that I have noticed over the last several decades of using this and recommending it. I feel moves the patient more quickly, but reduce neuroinflammation and improve nerve conduction are where a lot of the studies are surrounding with B12. So when I was mostly working with patients in the office and they had an autoimmune disorder or they had chronic fatigue or fibromyalgia, I would recommend 2 to 3 B12 injections a week for a month, and then go down to 2 injections a week for a month, and then 1 injection a week for a month, and then at least 1 or 2 a month thereafter. And I can't even tell you how quickly I could move patients along the path of recovery by doing it in a more immersion fashion.